Hi, Rachel. So excited to interview you today.
Hi, Suzanna. It's good to see you.
Yep, I appreciate you coming on the show and welcome.
Thank you.
And so this is Rachael Collier. She's the CEO of Total Employee Benefits, and it's an insurance broker firm here in Georgia. And she has an interesting story because even though she sells insurance to her clients as a health insurance broker, she has been in the PEO model with her actual firm for quite a few years. So I thought we would just talk about that initially, like why, even though you're a health insurance broker, why do you partner with the PEO for your internal employee benefits and processes?
Well, the original reason was as I was leaving another agency and had a group of 7 employees that were following me. And we had to quickly establish benefits. And because I'm in the industry, I did not want to go out and market my benefits and let everybody know that, that there was this dismantling. And part of the firm was leaving another firm. So it was all kind of done so that we didn't alert the market on what was going on. But in addition to that, being a small employer, having 10 employees or less, depending, to be able to have a dedicated HR resources, to be able to have them handle the EPLI, the workers' comp, the payroll, and of course the benefits, because working in the space with smaller employers, typically when you don't have a lot of employees to spread the risk, you're dealing with ACA community rating. You may be too small, not so much anymore, but maybe too small for level funding or alternate funding. And so to be able to go to a PEO and have those big company benefits at more competitive pricing was another reason. So there are really 2 reasons. But we continue to stay with the PEO, as you know, because you helped us with the second PEO transition that we went through.
And so initially you started out just because of privacy. You didn't want the whole world to know what you were doing. Exactly. And then as you entered the relationship, you saw that it really benefited your organization when it came to HR, the HR infrastructure, help you get better benefits for a smaller group. And so you continue to stay in the PEO model. And then, we just recently switched to another PEO company. So what has been your experience? Because you've been a client with 2 different PEO companies, and they're pretty large PEO companies. What has been your experience as far as being a client with them?
The grass is not always greener on the other side. It's just a different shade. So transitioning from one PEO, that large PEO, to this other large PEO, I'll tell you the implementation with the PEO that you took us to, which if it's okay, I can say who it is.
Yeah, sure.
So we went from Insperity over to TriNet. The implementation person at TriNet was fabulous.
Okay.
I believe her name was Tiffany. She made the whole experience.
All right. Shout out to Tiffany at TriNet. Woohoo.
She did a really good job. They're actually based out of, I think that division that I was dealing with is out of Bradenton, or she is somewhere, Sarasota, Bradenton area in Florida. And she was extremely knowledgeable.
Good.
And so that is great. The problem that a lot of employers tend to have is once that implementation is that baton is handed off to another team, that's where I think businesses wind up getting lost in the shuffle, because you're handheld through the implementation process, especially if you have somebody that's a rock star like Tiffany at TriNet.
It's hard to find somebody to replace those shoes.
Yeah, it is. And so that's been a bit of a hiccup. The big company benefits, the corporate discounts for cell phones and travel, and some of those bells and whistles that large organizations get, that, by the way, smaller organizations can still get on their own. And that's a benefit that we could talk about, but that's all embedded under that PEO structure. So the employees like that. It's a small employer. We are. with a big company feel through our benefits package. So I think that the employees like that flexibility. TriNet has a large amount of plans to choose from.
Okay.
Multiple carriers, where when you're with Insperity, you're primarily dealing with United Healthcare. When you're with TriNet, you have United Healthcare, you have Aetna. If you're in certain states, you might have Blue Cross Blue Shield of Florida. Yep, you could have. Of course, most of them have Kaiser out in California because the mothership of Kaiser's in California.
Kaiser. Yep. Kaiser's,
and I remember
Colorado as well.
Yes, Colorado too. I remember a stat that, and I don't know if it's the same, if it's changed, that 1 out of 3 Californians are insured by Kaiser Permanente. And at one point, Kaiser also was part of the prison system. So they always have to offer Kaiser, the PEOs do. But with TriNet, there were multiple dental carriers as well, multiple vision carriers.
So you and your employees really liked having multiple choices, not just one carrier to choose from.
Okay. Healthcare is personal, and to be able to, have multiple plans, I think gives the employee a sense of some control.
And some choice.
Yep.
Yeah. So I've heard of it as pros and cons. In your case, it's definitely a pro, and in a lot of cases it is. But in other cases, I've heard, especially when employees have companies have employees in multiple states, because then as far as the employer, it's hard for them to keep track of who's on what in what state, because there's so many different plans and so many different carriers. But
yes, you're talking about with TriNet. Yeah, for sure. Yep. And when you have to pull a report, or if the employer's like, I think I want to look at other options, it's a lot of data to pull, because
it's a lot.
You could have one person, you could have 30 employees and
30 states.
Yeah, 30 states and all these different plans, and that can complicate things.
Yeah. Well, I'm glad that you had a good transition implementation, and that you and your employees are taking advantage of the great Fortune 500 benefits that TriNet is able to bring to the table for you.
Yeah, it's been good.
So
I think just some takeaways, I guess, from a PEO that you and I have talked about before is some of the personal aspects. It depends on the PEO that you're with. Yeah. And so, Suzanne, how many PEOs are even out there?
Like 900 PEOs, really. Yeah. But when you're dealing with white collar and you're dealing with the type of, like the Insperities and the TriNets, I would say there's, probably maybe like 25, 30 PEO companies, but
that's a lot.
Still a lot.
So sometimes you lose that personal touch, and where you may have a team you're used to at one PEO, when you transition to another, that team goes away, and maybe you can't pick up the phone or email that person, and it winds up going into a service ticket. And so the way that PEOs service their clients are all very different. And everybody's going to promote their own PEO with, it's going to be like a dog and pony show when you kind of whittle it down to your top 3, and they're all going to sound amazing. So once you're actually in it, then you kind of feel and you have that experience. So I know that being with TriNet, we tend to more have that service ticket model. There's a question, we have to have a service ticket, and then it can take, 24 to 48 hours to get a response. So it's not as personable. And where our implementation experience was very
personal.
So there's pros and cons for sure with that.
Yeah. So let's talk about your clients, because you are currently you're a benefits broker. You sell benefits.
Yep. I like to call myself an advisor.
Yeah, I like that.
Advisor, because I don't just broker benefits. We'll advise clients on what's best for them. It could be anything from a fully insured ACA, Affordable Care Act type of program, to level funding, or just peeling it all apart. And we talked a little bit earlier about self-funding, reference-based pricing.
Lots of creative solutions in the market.
Yep. Direct primary care physicians, carving out your pharmacy benefit manager, travel. So benefits from an international perspective for certain surgeries, and also for medication. So there's a lot of different ways to slice and dice it.
Okay. So But in my experience, it seems like you still, in certain cases with some of your clients, you still shop out the PEO option as well. So talk to me a little bit about that. Why do you, because you have lots of creative solutions in your bucket. So why do you still have the PEO model to still take a look at that for your clients?
Well, some clients are relatively new businesses. They're growing. They may not have a dedicated HR person. And so with a company like that, we're working with a firm right now. They have probably 20 employees. That's a relatively new company. And they are not ready to handle the responsibility of carving it all out.
Okay.
And finding their own payroll vendor, doing the workers' comp, the EPLI, or the benefits, the dental, the disability, the life. And so they want it all under one umbrella. And so that is, and typically companies that we work with in the PEO space are less than 30 employees on average.
On average. Okay. So basically you're doing it because you see the value of consolidating all the single vendors into a single source solution and streamlining and automating their systems. Is that what I'm understanding?
Yeah.
Okay. They don't have the HR infrastructure. They don't have people internally to help the employees onboard, making sure that they handle it correctly on time.
Yep.
So the PEO can help manage that for them.
They do. Now,
you see the value
from being a PEO broker, the co-employment part of it, I think, scares employers.
They can.
And there might be some misunderstanding around what that means. I think some employers feel like they lose all control.
Yeah. Yeah.
But, I haven't found that in my perspective. We can still control the pay, the bonuses. We also embed our 401k provider with our PEO. So that makes it seamless. Some employers choose not to do that. But with this particular company, because they're still growing, there's a lot of moving parts. They don't want to dedicate the time to do that. I've also worked with other groups, larger, about 200 employees, and they wanted to peel away from a PEO.
Okay, so let's talk about that, because that's great. You've had experience introducing PEOs to some of your clients, and then you've had experience like plugging away from a PEO. So let's talk about those experiences.
Well, that group, like I said, it had 200 employees. They were with ADP Total Source.
Okay.
Big player, right?
Very big.
They did not
500-pound gorilla.
That is for sure, 800-pound gorilla. They did not like the lack of flexibility. They had some very unique benefit needs, especially from a short and long-term disability perspective. And some of these PEOs are not creative with that. ADP Total Source is not. So if you want to be creative and be able to offer long-term disability benefits, pay for the employee, but not have it a taxable event if they go out on claim, there's a way that you could have the employee pay for their long-term disability benefit, but you bonus them up in their pay to pay them back for that premium. And so if they go out on claim, then that long-term disability check is not taxed.
Right. And I'm very familiar with that. So ADP was not able to do that for them?
No, they are unable to do that. Well, they were at that time.
Okay.
This has been a couple of years.
Yeah, it could have changed.
Also, just some creativity around the short-term disability if the employer wanted to self-fund the short-term disability. And so some of those creative structures you're unable to do in a PEO environment. And then they also didn't like some of the other nuances of being with a PEO. I did not put them with the PEO. I was tasked to dismantle it. So the dismantling of that PEO, typically you have to give them 30 days notice.
Right.
The PEO does not want to provide you with all the information. They will make it difficult regardless of the PEO, typically. They house the data. You have access to reporting, but you might not be able to pull all the reports or know how to. So you have to go to the PEO and they know what you're doing.
And then they know you're shopping. Exactly. Right. You've already queued them in.
Yeah. So it gets a little dicey. So that particular group, I started working on that, I'm going to say in January, and we moved them for a 6/1 because that's ADP's renewal cycle. So, you do need to have ample
Have plenty
time.
of time to do the transition, especially the larger, the larger company, you're going to have more time. So 6 months, that's perfect. How
Yeah.
did the implementation go as far as unbundling and doing the different Ben admin systems? I'm sure you brought some tools to the table to.
Yeah, we did. We actually have a license with Employee Navigator. And so they decided not to use, they stayed with ADP for their payroll and decided not to use their Ben admin system. We provide our Ben admin system and we don't charge our clients for it. So we built it, we set it up, we have control over it. I think the implementation was good. We had to go out there. Of course, we went on site and did multiple open enrollment communication meetings, had to put together all the communication guides. It's a process, but we handled all that for them. I think it's important that the employer understand that they have to be able to make that decision and not continue to pass the buck or wait. So you want to do your open enrollment education meetings. I would say for a 6/1 effective date, I can't remember when we did it for this one, but I would say the end of April. And then do a 2-week open enrollment cycle period within the Ben admin system. That's ample time to close it out. And then employees had their ID cards by June 1.
Okay. So that is then my next question, because that's really what makes you stand out from any other broker out there. I mean, a lot of the brokers can get a lot of the same pricing, but it's that level of service that you bring to the table. And to be able to do the education of the employees in April, make sure everybody has plenty of time to do their enrollment in May, so that way June 1st, everybody has their cards, right?
Right. That is always the goal. Listen, one of the things we pride ourselves with is the advocacy. So we have total employee benefits. We refer to ourselves as TEB. We have fantastic advocates that work for us. So our clients have a dedicated phone number. It's a 24/7 phone number. An employee will call in, an e-ticket is created. The call is recorded and sent to the team that's assigned to that account. And then that licensed representative will respond, phone or email, however it comes in, really within minutes. We also have a language line for bilingual translation that we utilize.
Wow, Rachel, that's fabulous. I didn't even realize you had these tools available. It's
really
great.
Important. I mean, we want to make sure, like I said in the beginning, healthcare is personal.
Yeah.
Really, I should say sick care is personal. That's when you're really in the red tape of the complicated U.S. healthcare system. And even though we have transparency laws, a lot of hospitals aren't abiding by publishing their prices. People are still confused on what the cost is, what goes towards a deductible, what doesn't. And so we try to promote with our communication pieces, access to our advocates, language line services, just access to the employees to be able to help them and their loved ones maneuver through the complications of their health plan. Also, like what you're doing, we want to be able to create communication pieces and tutorials on, common terms. 96% of Americans don't know the basic 4 terms of a health plan: deductible, no insurance, no paying out of pocket.
Yeah, they don't know it until they have to use it.
Right. And when you have to use it, and that's when it's too late.
Yeah.
So there's a lot of nuances in addition to just medical and dental plans. There's the networks. What type of network is it? Do I have in or out of network?
Where's your employees located? Is it going to be a strong network in that area?
Yep. And you want to do reports, geo access or network analysis reports to make sure that the carrier has ample providers, medical, dental, vision in those areas, local or multi-site. So there's a lot of moving parts with it.
So I could see how that positions your firm separate from a lot of the other health brokers out there. They're not positioning themselves as advocates like yourself. And that's actually what I'm positioning myself as.
Yes.
Instead of a PEO broker, an advocate, fighting to get your best benefits without overpaying in PEO fees.
Yes. And you do an excellent job of that.
Thank you. Thank you. I appreciate it. So one last question. I thought if
Yeah.
you wanted to share something that's new, anything, there's lots of stuff going on as far as healthcare and the industry and
Woo!
just in Georgia. One thing I wanted to ask your opinion on is what do you think about that new law as far as transparency and no balance billing?
Yeah, the No Surprises Act.
Yes, the no surprise billing.
Yes, so that went into effect January of 2022.
Hmm.
It is not for all providers. So air ambulance is not included in that, which
Oh,
would have been great. I mean, you can get a $90,000 air ambulance bill.
wow.
So
I
they're
could have
not
bought a
part of it.
Tesla for that.
Oh yeah, for sure. But then you have to find a charging station that actually works. So yeah, that's a whole other
Yeah,
conversation.
yeah.
Yeah, so the No Surprises Act, there are some states like New Jersey that have their own mandated state with no balance billing, which is probably a little bit more robust than the No Surprises Act. I think they're still working out some of the kinks with that.
Hmm.
But what we do is in our communication pieces, we remind employees that there is this, we have a legislative section in our benefit guides, reminding them of the No Surprises Act, providing a link to it or a website. But honestly, it's still the transparency part of it, the understanding of it, the fact that you have to go kind of through a third party kind of appeals. It's not an appeals. I'm not thinking of the correct term right now, but what do you call that?
As you think of that, just for my audience to know, the No Surprise Billing Act is whenever you go to the doctor or facility or surgery, and then you get a bill stating that your anesthesiologist was not in network, and now you have to pay out of network coverage, and you're just like, whoa! You get this huge bill. You're very surprised. That's why they call it the Surprise Bill Act.
Yes. So it's like a mediator that you go to.
Okay.
And there are rules around it, but it does help with your radiology, anesthesiology, pathology, your ER doctors. That's another big area where an employee goes to an emergency room because they think it's life or limb threatening.
Right. And it's
They
not.
go in. The hospital, happens to be in network, and it doesn't have to be because it's an emergency room,
Right.
but the physician might not be. And so the physician might be an hospitalist, or they're part of another organization that
Yep.
hospital uses. And so the members are now getting balance billed from the doctor. And that we worked on and still continue to work on a lot of balance billing issues with emergency rooms. Even though this law has been in effect, they're still kind of pushing that envelope. And it's just kind of like the transparency laws where hospitals have to publish what their costs are. And if they don't, there are hefty penalties. Some of them still aren't, and they're just paying those penalties.
Wow. So, unbelievable.
This will eventually kind of iron out a little bit more, but even though it went into effect in January of 2022, we're still, learning, and there are going to be additional provisions that are going to be added to that law.
Okay. Well, we shall look forward to see how it plays out. Exactly.
So, yeah, there's a lot going on.
I know. So is there anything else you would like to share with me and my audience as far as what else, some hot topics, news in the industry, things to be aware of, or?
Yeah, I mean, I guess the only thing that I would say to your audience and employers is, kind of attracting and retaining, the benefits piece is part of that. They used to call it fringe benefits back in the day. Yeah. I am seeing a lot of companies, instead of going towards higher deductibles to help, reduce or lower their premiums, they're actually looking at ways to remove or reduce the barrier to care. The barrier to care meaning higher deductibles, higher copays. So there are programs out there that are being rolled out or have already been rolled out that have removed deductibles, that have no copays for certain visits, if it's not telehealth or primary care, and certain prescription drugs going under a zero copay. So trying to provide benefits to remove the barrier of care so that employees and members will actually go
use it and take care, do all the preventative stuff before it gets
to be preventive care is typically, that's under the Affordable Care Act. So that's covered at 100%, no copay, no deductible. And you can go to healthcare.gov to see what's covered based on your age and gender. But even for sick care, so if you go to a primary care physician and you think you have the flu, you don't know what's wrong, there are some programs out there with insurers that now have zero copay, even for your non-wellness type of benefits.
Yeah.
And then there's other interesting plans that are out there that help employees pay for some of their out-of-pocket expenses. I'm not talking tax advantage plans like FSAs or HRAs, HSAs. These are other type of payment options that the employer can include in their benefits. It would be like an embedded Visa card on an app. You go to the doctor, you go to the dentist, you can even use it for vet expenses. And the employer will determine how much. It could be $500, it could be $1,500, and the employee can use those funds and then pay for it, payroll deduct after tax. So you can have that tied to your FSA, to your HSA. There's no credit check and there's no fee for the employee.
Okay.
If the employee leaves that employer, the employer is not stuck with that debt. It follows the employee. And the employee then payroll deducts it back or bank drafts it if they leave the employer. So
I haven't heard of that. That sounds pretty fantastic.
There's a lot of really creative programs out there.
You have to be right now with what's going on in the marketplace. You have to be creative. Yep. So let's talk a little bit before we wrap up. You talked about attracting and retaining talent and using your benefits to help you do that. You're using this strategy, this Visa strategy for your employers. What other types of strategies, or what else do you recommend as far as like their contribution strategy to be really to attract top talent so that way they'll accept the offer and not leave?
One of the things that we do is we provide a benchmark. So we'll provide a benchmark report to be able to share with our clients or prospects to share what, based on industry, region, what they're charging in their specific benefit portfolio and how that compares to their industry, region, or national averages. So that's a good starting point. The national average on what an employer pays towards an employee's health insurance is still about 80% of the single cost, a little bit less for dependent coverage, about 60 to 70% for dependents. Some employers are still doing spousal waiver bonuses, where if you can prove your spouse has benefits through their employer, there is some administrative work on the employer to do this, then they will give that employee a taxable bonus and then hopefully incent that employee to come off of their group plan. You can't do that with Medicare because it's illegal to incent people off of the plan and put them on Medicare. But if they do have, if a spouse has other group coverage, those are other things that employers are still looking at doing.
Okay. Awesome. Cool. I really appreciate it. This has been
it's
fabulous. Yeah. Thank you for all the insight to your industry, and you can tell my audience how they can connect with you if they have any additional questions.
Well, definitely you can connect with me on LinkedIn. I love LinkedIn. It's a great platform for me. So Rachael Collier at Total Employee Benefits. And then you can also call me on my cell at 678-643-RACH, RACH.
Excellent. Thank you, Rachael.
You're welcome. Thanks.